still an audio issue. Hello. Hi, everyone. It's Tuesday, June 2nd. Got to keep saying that date because tomorrow is my husband's birthday. Cannot forget, cannot forget. All right, I'm Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, here to give you our daily update on the impact of pandemic COVID-19 on Mobile County. And as we often do, I'm a little bit more prepared today than I was yesterday. I'll start with the global figures. So the Johns Hopkins University of Medicine dashboard is reporting 6.3 million cases of COVID-19 around the U.S. around the globe, with 377,000 deaths. For the United States, 1.8 million with just over 105,000 deaths. Then in Alabama today, the new and improved data and surveillance dashboard is reporting 18,354 confirmed cases, 288 probable, with 649 confirmed deaths and 2 probable deaths. They are reporting 9,355 presumed recovered since the outbreak began in early March. So again, we are only changing the first page of our daily report. So this gets updated daily, Monday through Friday, or on weekdays. So again, today, Mobile County is reporting on 2,281 patients with COVID disease. 2,272 of those were laboratory confirmed, and 9 are counted as probable cases. That's an increase of 28 over yesterday. We've had 1 additional hospitalization since yesterday and 0 deaths. So that's the good news. And again, you can see sort of the recent 14-day trend in the number of cases reported. We actually have seen a slight decrease in the number of cases reported compared to the last 2 weeks ago. So again, week before last, the numbers were slightly higher than we have seen in the last week. I won't go into too much detail. We did that yesterday about what's on our new report. Again, we are showing presumed recovered around 60% in Mobile County, holding steady at about 15% of our cases being among healthcare workers, with around 28, 26, 27 of our cases affiliated with either employees or residents of long-term care facility. So let me add that correctly. It's actually 23, sorry. I can't add and talk at the same time. Again, the week ending this past Saturday, we added just 230 cases compared to 299 the week before. But I do want to point out that in the last 2 weeks, we've had almost 600 cases added to our case count, which is extremely important to remember that we are still very much in the throes of the effect of the pandemic on Mobile County, and indeed in the rest of Alabama. As you've probably seen in the news, there are some other hot spots around the state that are really struggling to cope with the complications of COVID disease. And with that, I think I will end. I will just mention we did start providing some information on laboratory results reporting, and at least by the end of last week on Saturday, there were 28,000 or so lab reports that had been reported to the Alabama Department of Public Health. And among those, the week ending May 30th, 8.8% of those were positive. So plenty of testing capacity. Anyone who thinks they need a COVID test right now can get a test. So if you are not able, if you think you need a COVID test, you think you might have been exposed, you just don't feel right, you heard that somebody at your workplace was diagnosed and you're worried about your health, anyone who believes they need a COVID test can get one through the Mobile County Health Department at no cost to the patient. So call our line at 251-690-8890 and schedule yourself an appointment to get a test for COVID if you want. Oh, sorry. Oh, that was totally wrong. 8889. Okay, I'm going to start over. 251-690-8889. All right, thank you guys. So I just wanted to point out, a lot of you have asked me, and relentlessly, about the number of different types of data points that we're not able to provide because we're not the authority. But there's a CNN dashboard that provides data on Mobile County, and it's actually pretty good. I mean, it's pretty close. They pull the Mobile data directly off the Alabama Department of Public Health website, but it contains data that you guys ask me about all the time, and I'm not authorized to give it. I'm not sure how they got it, but you can check the data source. It gives the number of hospitalizations today, how many ICU cases for COVID, and how many COVID patients are on ventilators. And again, also available bed capacity, ICU capacity, and available vent capacity. So if you are just, beside yourself with curiosity about that information, you can check that data source and verify it on your own, because I have not verified it. I don't even have this information myself, but it does give some stuff that you guys have been asking me for that I'm not authorized or to reshare. So I just wanted to mention that. Don't be alarmed when you see that bed capacity and vent capacity is at 94, 95, 96, 98%. That's the way hospitals like it. They like for their billable beds to be full. We did hear yesterday on a statewide call that 72 additional ventilators have been made available to and will be shipped to Alabama, destined for Mobile County if they need them very soon. So again, at least now there doesn't seem to be any shortages on ICU beds or ventilators. All right, here are a couple of questions. Let's see, are health officials worried about a spike in COVID cases after all the protests this week? I have been asked this question several times, and I'd actually like to read a statement from a medical officer with the Alabama Department of Public Health who very eloquently said that, the health department is very saddened by the death of Mr. George Floyd and extends its condolences to the family for its terrible loss. As citizens exercise the right to peaceful protest, persons should be aware of ongoing risk of COVID-19 transmission in Alabama. The health department continues to remind that measures to reduce COVID transmission include social distancing, good hand hygiene, and the use of cloth face coverings in public as critically important measures to protect individuals and the community during this outbreak. And again, these things do not just apply to the protests. It applies to crowded beaches and to crowded big box stores and to 30 people waiting in the parking lot of the pizza store to get their pizza or any other food that is curbside delivery. So just because you're outside does not mean that the 6-foot rule does not apply, that face coverings are not recommended. They are. So please, I was asked the same questions last week when it was like, oh, what about the gathering, of the beaches around Memorial Day? Same thing. Gatherings, bad for COVID transmission. So please remember that. And we will continue to emphasize that we are not near the end or maybe even the middle of this pandemic. We still have a long way to go. So again, I want to thank Dr. Landers for that statement, sharing concern and about what's going on in the U.S. and just encouraging people to continue taking precautions to protect themselves from COVID transmission. Have there been any cases of MISC in the county, and if so, how many? So MISC is multi-organ inflammatory syndrome in children, and to date, we have had no cases reported in Mobile County residents. We had been notified of a couple that were under investigation, but they turned out to have other explanations for what was happening with their health. So to date, we do not have any cases reported among Mobile County residents. Let's see, I may be reading it wrong, but it looks like by week there's a consistent drop in the number of deaths and hospitalization, also the number of tests, numbers, cases bounce up and down. Can I give an overview in a statement? Okay. Yes, the number of cases, hospitalizations, and deaths has decreased slightly over the last 7 to 14 days. This is encouraging, but we are still cautious about people needing to follow the social distancing and protective measures when they are in the community milling about. We are not over, we're not done, we're nowhere close to being done. So yes, seeing a reduction in cases, deaths, and hospitalization is encouraging. I'm worried a little bit that it may partly be due to the 3-day holiday last weekend when labs and people were probably not, didn't have COVID testing on their minds. That may have partially resulted in a reduction in the number of positive test results and the number of tests conducted. But yes, it is true that over the last 7 to 10 days, we have begun to see a downward trend in those indicators. Last week, I said that the county health department would be offering free tests to nursing home staff. This is true. We have begun queuing the COVID negative long-term care facilities and offering to provide testing to all of their employees. We start with the first location, I believe, started today. Yeah, this morning at 8 o'clock, I think. We're working with an EMS provider that we're contracted with, and then working very closely with LabCorp and the state public health laboratory to get those testing supplies and the PCR test conducted. And the long-term care facilities are doing their part by lining their workers up and filling out paperwork in advance and all of that. So we have begun that. It started today, and we will continue to provide that until we can get every employee at long-term care facilities tested at least once, so that we can gather some information with which to make some decisions about the need for ongoing testing, ongoing surveillance for COVID and employees through PCR testing. Yes, so that's how it works. Again, we have 27 or so facilities that are currently COVID free, and it takes time. So we don't think we would be able to, do more than 1 or 2 or maybe 3 a day. So as you can imagine, it will take some time to work through everyone. And then how many tests are performed, it depends on the number of employees that they have. And right now, we're just going to try to get through all of the facilities and then make some decisions about additional testing based on what we find. You have to imagine this is it's a need for the facilities, yes, but it's also very challenging for them. If they have staff that test positive, then they almost instantly have a reduction in workforce and have to move to contingency planning for staffing. So they're partnering with us. Most of them are open to this recommendation and are either doing it themselves. Many of them are doing it themselves. But those that want to accept our assistance, we are happy to partner with them. So if an employee tests positive, then the guidance is that employee, if there is enough staffing to maintain the critical care of the patients, then the employee would go home for 10 days if they were asymptomatic, and longer if they became symptomatic. But if the staffing model gets so low, and this has been a CDC recommendation from the beginning, then contingency staffing plans include things like, continuing to work healthcare workers that are asymptomatic but have a positive test in certain areas of the facility and under certain conditions, as of wearing a mask and those sorts of things. There's a whole big old long list. So this is what has been going on since 2.5 months ago. We've been following CDC guidelines when we have a potential shortage of staff in a long-term care facility. Oh man, I've got the answer to this next question right on my tip of my tongue, I think. So someone from Facebook was asking about remdesivir, how much for Mobile, and I just got this answer earlier today because I was very curious about this today. On a statewide conference call, the Alabama Department of Public Health announced that the state will be receiving 1,400 additional vials of remdesivir, golly, and that'll be coming to Alabama and distributed, and we don't know if we're going to be getting any more after that, but I can read to you, I think, if I can grab it. We've gotten the 4 the four not including women's and children's, because I don't believe they've gotten any doses, because again, these doses are for people who are in ICUs, and those are adults, and they're mostly being treated at Infirmary, Spring Hill, USA, University, and Providence. So again, I believe it was around 1,700 doses that have been free doses that have been shipped to Mobile hospitals. The Alabama Department of Health portal site is not updating as frequently. Why? Well, partly because it's a lot of work to work 24 hours a day to try to clean data and keep it clean so that it can be refreshed frequently on that dashboard. It's the same reason that we have gone, away from publishing the report 7 days a week, and now only providing it 5 days a week, and really only weekly for many of the indicators. So what we're trying to do is move in sort of a sustainment mode of the outbreak, so that we can, save time and resources and not have to work our staff so hard, and instead get to something that's more manageable with the resources that we have at our fingertips. Remember, none of us have gotten additional staff with COVID funding. We're using the staff that we have and repurposing all of them, most of them, for COVID. So that is a real strain on our system, and we would like to sort of give some releases on the pressure valve where we can. The other reason is that there was a lot of activities responding to questions, because this number didn't match that number and didn't match the other number. And one of the ways to get around that is just to update the dashboard, once a day, or to update some of the reports once a week, so that those numbers are not changing every day, because it literally would depend, the counts would depend on what time you looked at the dashboard. So by the time you wrote it down and went to your meeting and reported it, the number could have changed. So those are a couple of the reasons why the Department of Public Health decided to revamp their dashboard and publish it only one day, or refresh it only one day a week. You will see some additional changes coming out over the next days and weeks. And what the state is trying to do is to add some of the data on the indicators, what we call the gating indicators, that are in the White House's proposal for what needs to happen surveillance-wise before we can begin to reopen as a country, to say that we're getting back to normal. All right, where can you buy hand sanitizer so you can be ready for a hurricane now? I don't know. I have seen, when I am out retailing or shopping, I do see hand sanitizer that is out there ready for purchase. It's not the hand sanitizer that I was accustomed to seeing before COVID. The brands may be different, the shape of the bottles may be different, but there are some retailers that are able to restock their shelves with hand sanitizer. So please look for that. And if you can't find any, then take a bar of soap and a cloth wash rag and put it in a Ziploc, and put that in your go kit so that you can wash your hands with soap and water. Let's see, someone was getting a little sassy with me yesterday when I said that some of the data that we use, we look at it internally to sort of make decisions within our agency, using information that we don't provide publicly, and they were just commenting on that. You all would like data so that you can make your own decisions, and we are committed to doing that. And I think our track record shows that we periodically, when we feel like it's the right time and that the data are credible enough, we continue to add more and more information to our public report. So again, things like zip code. Mobile County is the only jurisdiction in the state of Alabama that is showing data by zip code. Granted, it's not as much as you all would like, but we are committed, and we do have a track record of providing data to the public so that you can see it when we feel like it's credible. Where can I get the daily number of people tested and recovered? Y'all suddenly stopped posting that information. That's not true. We published that information yesterday on our website. It's also on the Alabama portal. So in our report, you can see the number presumed recovered. It's just calculated slightly differently than we had been doing a few weeks ago because we adjusted to get in line with the state once they started reporting presumed. And we also included a graph yesterday, that includes the number of test results by week and by result. So that was information that we had not reported previously, but you can also get that on the Alabama Department of Public Health website. Then there's a comment yesterday on Facebook. I think the gist of the comment was suggesting that there's this sort of rumor or conspiracy theory or belief that every death during coronavirus is being attributed to coronavirus instead of things like violence or natural causes or accidental deaths. And I have seen the real numbers on the deaths reported in Mobile County the first 4 months of 2019 through the first 4 months of 2020. And most of this is public information, so you can look it up if you want to do some fact checking. But during the first 4 months of last year compared to this year, COVID became the 7th top leading cause of death in April of 2020 compared to last year. The other causes of death, like motor vehicle accidents, other violence, cardiac disease, stroke, all of those had remained relatively the same or had actually gone up slightly as compared with last year. The only leading cause of deaths that went down were pneumonia-related deaths and respiratory-related deaths because, of course, these are being coded to COVID appropriately because those are the conditions that are caused by COVID. So when you see an increase in deaths being coded as COVID, these respiratory illnesses, then of course those percentages go down for those other categories. So again, I just wanted to share that because I really bugs me when people maybe don't believe the stuff that we're reporting, but there is information out there that can document that yes, we are coding a lot of COVID deaths because they're occurring, and the number of other types of deaths other than respiratory illness are staying about the same. So with that, are there any Facebook comments that I could deal with today? All right, I'm sure you'll let me know what you want to hear tomorrow. I will not be here on Facebook Live tomorrow. A couple of our other employees, my colleagues here, will be here to talk about some of the activities going on in their part of the health department. So I'm super excited that you guys will have a special treat tomorrow to hear from Pebbles King and Virginia Gordon. So thank you, and you'll hear from Mobile County Health Department tomorrow.